Linoleum smells like false promises and floor wax, and the cold of a northern Ontario winter seeps through the walls of a small clinic no matter how high you crank the heat. Crestwood Family Health Center wasn't a hospital. It was a converted strip mall unit between a dollar store and a nail salon, staffed by 2 part-time doctors and whatever nurses the temp agency could spare on a given week. Tevita Fono had been working there for 11 days. 11 days of taking blood pressures on elderly patients and refilling hand sanitizer dispensers, and being reminded, in various polite Canadian ways, that she was not permanent staff and should therefore not reorganize the supply room. She had reorganized the supply room anyway. The charge nurse was a woman named Sandra Ouellette, not the Sandra from accounting. Dr. Parchovic had clarified helpfully on Tevita's first morning, as though there were so many Sandras that disambiguation was a daily necessity. This Sandra had a silver bob cut and wore compression socks with a pattern of tiny maple leaves and had opinions about absolutely everything, especially about agency nurses who arrived with no references and an employment gap that stretched back 3 years and hadn't been explained to anyone's satisfaction. Tevita hadn't explained it. She hadn't been asked directly, and she wasn't volunteering. The gap was where she had been. The gap was where she had learned things she was still trying to unknow. "You're floating today," Sandra told her on a Tuesday morning in late February, handing Tevita a patient list without looking at her. "Dr. Parchovic needs someone to do intake in the walk-in side. It's mostly colds. Don't try to diagnose anything. Take the vitals, write down the complaint, flag anything that looks actually sick. The nurses on my team will handle the rest." "Understood," said Tevita. Sandra looked up then, briefly, with the expression of a woman who had been mildly disappointed by the world so many times that mild disappointment had become her resting state. "You've done walk-in intake before." "I've done walk-in intake before," Tevita confirmed. She had done considerably more than walk-in intake before, but that wasn't information Sandra needed. The walk-in waiting room held 14 orange plastic chairs, a dying potted fern, and a television mounted near the ceiling that played a Canadian morning news program on a loop with the volume set low enough to be useless and high enough to be irritating. Tevita sat at the intake desk for most of the morning and did exactly what she had been asked to do. She took vitals, she noted complaints. A retired school teacher with a chest cold that had been going around, a young father with his daughter who had an ear infection and was coping with it by crying with the sustained, committed intensity of someone who had found her calling, a teenager with a rash on his forearm that turned out to be contact dermatitis from a new watch band. Tevita triaged each one, wrote her notes neatly, and sent them through to be seen. She was documenting the teenager's watch band when she noticed the man in the corner. He had been there when she arrived at 8. It was now 20 past 10. He was somewhere in his mid-50s, thick-set, wearing a heavy canvas work jacket with a Hydro One logo on the chest, the kind of jacket that had absorbed so many winters it had become its own weather system. He was sitting very still. His hands were folded in his lap. He was not looking at the television. He was not looking at his phone. He was looking at the far wall at approximately nothing, with the concentrated blankness of a man trying very hard not to let anyone know how much pain he was in. Tevita watched him for 4 seconds. That was all she needed. She walked over and crouched down to his eye level, which meant she was crouching fairly low because he was a tall man even sitting down. "How long have you been waiting?" she asked. He blinked, refocusing on her like someone coming back from somewhere else. I signed in, he said. His voice was careful, controlled. She recognized that tone. It was the voice of a man applying significant internal resources to sounding normal. Around 7:30, I figured it was a cold. My wife said, "Come in." "What's your name?" "Bergeron. Gilles Bergeron." "Okay, Gilles. Can I take your blood pressure?" He held out his arm obligingly. She cuffed it. She pumped it. She read it. The number made the back of her neck go very still. "Walk with me," she said. She got him into the back hallway before she asked the next question, because she didn't want to ask it in front of the 14 orange chairs and the dying fern. "When did the chest pain start?" Gilles Bergeron looked at a point somewhere above her left shoulder. "It's not really pain," he said. "More like pressure." "When?" A pause. "Yesterday afternoon." She looked at him. He looked at the wall. "I thought it would go away," he said. "It didn't go away." "No," he agreed. She turned and walked to the medication room, where Dr. Parchovic kept the emergency kit in a locked cabinet that was secured with a padlock whose combinations Sandra Ouellette changed every 3 months for reasons that had never been explained to Tevita. Tevita had noticed the combination the third time Sandra had opened it in front of her, because Tevita noticed things like that reflexively and couldn't stop doing it any more than she could stop checking exit routes when she entered a room. She opened the cabinet. She pulled out the aspirin. She pulled out the portable ECG leads. She put her head out the door and looked at the receptionist, a pleasant young man named Jordan who wore cardigans and had a perfect attendance record. "Jordan," she said, "I need you to call 911. Tell them we have a probable STEMI at Crestwood Health, 8 and 47 Regent Street. Tell them to bring the cath lab team on alert. Don't ask Sandra first. Call now." Jordan stared at her for approximately 1 second. Then he picked up the phone. She went back to Gilles. She got 4 aspirin into him and the ECG leads on his chest in the time it took Sandra Ouellette to appear in the hallway, moving with the particular speed of a woman who had heard the words, "Call 911," without being consulted first. "Who authorized this?" Sandra demanded, looking at the leads, at the readout already printing on the portable unit at Tevita's face. "I did," said Tevita, not looking up. "You are an agency nurse on the walk-in side. You don't have authorization to. TST elevation in leads 2, 3, and AVF, Tevita said, still looking at the readout. She pressed it flat against the wall so Sandra could see it too. "Inferior STEMI. He's been symptomatic for approximately 18 hours. He needs a cath lab within 90 minutes, or we're talking permanent myocardial damage." Sandra looked at the readout. Something moved behind her eyes that wasn't quite deference, but was structurally adjacent to it. "Dr. Parchovic is with a patient," Sandra said, then interrupt him. Silence, the kind of silence that had weight and texture. "Or we can have this conversation in 30 seconds when the paramedics arrive," Tevita added quietly, "and you can explain the delay to them." Sandra turned and walked quickly down the hall. Gilles was watching Tevita with an expression she had seen before, on other faces, in other places with worse lighting and no linoleum. The expression of a person who has just understood that the situation is serious and has chosen to trust the nearest steady set of hands. "Is it my heart?" he asked. "Yes," she said, because he was the kind of man who would rather know. He exhaled through his nose, slow, controlled. "Okay," he said. "Your wife should come," Tevita said. "She's going to say she told me so. She did tell you so." Something flickered across his face. Not quite a smile. "Yeah," he said. "She did." The paramedics arrived in 7 minutes. They were a 2-person crew, a young woman with a red ponytail named Ashby on the paperwork, and her partner, a quieter man who worked efficiently without being asked. They took one look at the ECG readout. Tevita handed them and stopped looking at her like she was a clinic intake nurse. They started talking to her like she was someone they would want on the truck. Tevita handed off the vitals, the timeline, the medication already administered, the ECG documentation. All of it clean and organized in the way that fieldwork makes you organize things. Because when there is no time later, the now has to be perfect. The red ponytail paramedic, Ashby, paused in the doorway with the gurney. "Were you emergency before?" she asked. "Intake," said Tevita, which was not an answer, and they both knew it. They took Gilles out through the side door. His wife had been called. He would make it. The numbers and the timing and the intervention were on his side. And sometimes that's enough. Tevita stood in the back hallway and listened to the sound of the ambulance pulling away and felt the familiar hollow that comes after adrenaline when there's nowhere left for it to go. She went back to the intake desk. She picked up the next chart. Sandra appeared at her shoulder 40 minutes later. "Dr. Parchavik wants to speak with you," Sandra said. She paused. "About the protocol deviation." "Of course," said Tevita. She followed Sandra to the small office at the back of the clinic that Dr. Parchavik used when he wasn't in an exam room. A room so stuffed with binders and continuing education pamphlets that sitting down required navigating a paper maze. Dr. Parchavik was a thin, anxious man in his late 40s who had done his residency in Toronto and moved north for reasons he hadn't shared and Tevita hadn't asked about. He had a good face for medicine, a face that conveyed concern credibly. He looked at her for a moment. Then he said, "The hospital called." Tevita waited. Gilles Bergeron was in the cath lab 40 minutes after he arrived. The cardiologist said, if he'd waited another 2 or 3 hours, we'd be having a very different conversation. He paused. "The ECG you ran, the aspirin protocol, the way you documented the handoff, that wasn't walk-in intake work." "No," said Tevita, "it wasn't." Another pause. Outside the office, Sandra could be heard making a phone call. "The agency file on you is thin," Parchavik said carefully. "There's a gap." Tevita looked at a point on his bookshelf, at a thick binder labeled CMA Guidelines 2019. "There's a gap," she agreed. He let that sit for a moment. He was a careful man, Parchavik, the kind who didn't push at things unnecessarily. Tevita appreciated that. "Sandra's concern," he said finally, "is about liability. Scope of practice, I understand. My concern," he said, "is different." She looked at him. "My concern," he said, "is that you're somewhere between overqualified and under-supported, and I'm not sure what to do with that." He straightened a binder on his desk, aligning its spine with the edge. "I'd like you back tomorrow, if you're willing. Full shift. And I'd like to discuss a more formal arrangement with the agency." Tevita said nothing for a moment. "I'm not looking for something permanent," she said. "I know," said Parchavik. Neither was Bergeron, probably, when he signed in this morning. She hadn't expected that. She looked at him more directly. "Think about it," he said. She went back to the intake desk. The walk-in side was quieter in the afternoon. A case of strep throat, a sprained wrist from a hockey practice fall, an elderly woman who had driven 40 minutes a snowstorm because she was worried about a mole on her forearm that turned out to be a benign seborrheic keratosis that had been there for years. Tevita told her it was benign. The woman cried a little, from relief, and Tevita got her a cup of tea from the machine in the hallway and sat with her for 3 minutes while she drank it. This was also something Tevita was trained to do. sit with people in the moment between fear and okay. She was restocking the intake desk at 4:20 when the outside door opened and brought in a blast of February air, cold enough to burn exposed skin, and with it, two people she had not been expecting. The first was a woman she didn't know, dark-haired, early 40s, wearing civilian clothes under an open RCMP jacket, the Royal Canadian Mounted Police crest visible on the fleece beneath. She moved like someone who had been trained to enter rooms efficiently and had never unlearned it. She was supporting the second person, a young man, 19 or 20, who had his left arm folded against his chest and his jaw set in the rigid way of someone who is managing pain through determination alone. Behind them, through the glass door, Tevita could see an unmarked dark SUV parked at an angle across two spots, the way emergency vehicles park when they don't have time for courtesy, and another figure outside, standing at the vehicle's rear, scanning the parking lot. The RCMP woman crossed to the intake desk in 4 strides. "I need a nurse," she said. Tevita looked at the young man's arm, at the angle of the elbow, at the pallor around his mouth, at the way he was holding his breath in shallow, careful increments. "What happened?" Tevita asked. "That's classified," the woman said. Then, seeming to recalibrate, "He took a fall, hard surface. He wouldn't let us call an ambulance." "I'm fine," the young man said, with the conviction of someone who is definitively not fine. Tevita came around the desk. She reached for his arm, not grabbing it, just positioning her hand beneath the forearm to take some of the weight, watching his face for the micro-expression that would tell her where it hurt most. He flinched when her fingers moved along the proximal forearm, near the radial head. "Radial head fracture," she said quietly. "Possibly the olecranon too, depending on how he landed." The RCMP woman looked at her. "You can tell that without imaging?" "I can tell that without imaging," Tevita confirmed. "Can you treat it here?" "I can immobilize it and manage the pain. He needs a proper X-ray to confirm the fracture pattern, and depending on what they find, possibly surgery, but I can stabilize him and make him comfortable enough to transport." She looked at the young man, who was looking at her with an expression caught between wariness and an involuntary relief that was leaking through despite his best efforts to contain it. "I'm going to get you something for the pain first," she told him. "Then we're going to deal with the arm." "I don't need," he started. "You do need," she said, not unkindly. "You're doing a very good job pretending otherwise. But your blood pressure is probably somewhere alarming right now, and your body is working hard to compensate. Let me help." He stopped arguing. This was also something she had seen before. The moment when someone who has been holding themselves together through sheer will reaches the part where they can stop. Sandra appeared from the back hallway with the expression of a woman who had already used her capacity for surprises once today and was not enthusiastic about using it again. "What's happening?" Sandra said, which was not technically a question. The RCMP officer stepped slightly forward, and something in how she moved changed the calculus of the room in a way that was hard to articulate. She produced an identification card, held it out for Sandra to read. "Staff Sergeant Elodie Favreau," she said, "Major Crimes End Division. I need your facility to treat my witness." Sandra read the card. She looked at Tevita. She looked at the young man's arm. "The on-call doctor is in with a patient," Sandra said. "I can manage this," Tevita said. Sandra turned to look at her fully. There was a long moment that carried inside it approximately 6 different conversations they had never had. "I'll get the supply cart," Sandra said. Tevita worked efficiently, the way she had been trained to work in environments where efficiency wasn't an aesthetic choice but a survival one. She got an IV line in cleanly. The young man, whose name she still didn't know and didn't ask, tracked her hands with the focused attention of someone who had been in enough situations to know that competent hands are worth watching, and pushed enough analgesia to bring him back from the edge of what he had been managing alone. She irrigated and dressed the abrasion on his forearm. She fashioned a posterior splint from the plaster supplies in the treatment room, applying it with the particular economy of someone who had done this in worse conditions than a well-lit clinic in northern Ontario. Staff Sergeant Favreau stood in the doorway and watched without speaking. She had good discipline, Favreau. She didn't hover. She didn't interfere. She just stayed present in the way that people who are responsible for someone else's safety stay present. Alert, quiet, ready. At some point during the splinting, she said, without preamble, "Where did you serve?" Tevita looked up, then back at the plaster. "I didn't say I served," Tevita said. "No," Favreau agreed. A pause. "RCAF," Tevita said. "Forward aeromedical staging, 3 rotations." She didn't say where. She had found that if you said what people usually didn't push for where, and where was the part that had weight. Favreau nodded, the nod of someone filing information, not reacting to it. "I wondered," Favreau said. "You cleared the environment when we came in. You checked the door twice. You positioned yourself with your back to the wall before you started working." Tevita said nothing. "I do the same thing," Favreau said. The young man was looking between them with the dawning expression of someone realizing that the 2 adults in the room are conducting a conversation that exists on a frequency he can't quite access. Tevita smoothed the last edge of the plaster splint and began wrapping the outer bandage. "He needs an orthopedic consult," she said to Favreau. "Preferably tonight. There's a fracture clinic at Health Sciences North in Sudbury. If you're heading south, I can call ahead and get him flagged as urgent." "We're heading south," Favreau confirmed. "I'll make the call." She finished the wrap, checked the distal neurovascular status, sensation in the fingers, capillary refill, radial pulse, everything where it should be, the arm adequately immobilized. She stepped back. The young man flexed the fingers of his splinted hand experimentally, and the pain in his face had stepped back to something manageable, something he could work with. "Better?" Tevita asked. "Yeah," he said, and then, as though the word had slipped out before he could stop it, "Thank you." She nodded. She went to the front desk and called the fracture clinic in Sudbury, and spoke to the triage coordinator for 4 minutes and arranged an urgent referral. She printed the documentation, the assessment, the medications administered, the splint specification, the care instructions, and had it ready when Favreau appeared in the hallway. Favreau took the papers, scanned them with the rapid efficiency of someone who reads documents the way other people breathe, and looked up. "This is thorough," she said. "Field habit," said Tevita. Favreau looked at her for a moment. Then she reached into the interior pocket of her jacket and produced a card, plain white. RCMP crest, her name, rank, a phone number. "We work with a lot of federal witnesses," Favreau said. "Sometimes in situations where conventional medical response isn't available or isn't appropriate." She paused. "I'd find it useful to have someone I could call who understood both sides of that." Tevita held the card. "I'm a temp," she said. "Agency staff, walk-in intake. I read your hands," Favreau said, "when you were splinting. Forward aeromedical staging teaches you to do that. Immobilize and package fast, in the dark if necessary, while other things are happening around you. She let that sit for a moment. You're not walk-in intake. Tevita didn't answer. Favreau stepped back toward the door where her colleague was already getting the young man into the SUV. Keep the card, she said. You don't have to call. She pushed through the door. The February air came in again, sharp and clean and cold, and then the door swung shut and the room was quiet. Tevita looked at the card. She set it down on the intake desk beside the patient roster and the blood pressure cuff and the administrative forms that told her she was a temporary agency nurse, assigned to walk-in intake at a clinic between a dollar store and a nail salon in a small city in northern Ontario. Sandra appeared from the hallway. She stopped when she saw Tevita's face. Or perhaps she stopped because of something else. Because the room still held the particular charge that certain kinds of events leave behind, like the ionized air after lightning. Administration is going to want to know about this, Sandra said. I know, said Tevita. The RCMP officer, the witness, the treatment you provided outside your stated scope. I know, said Tevita again. Sandra stood very still for a moment. She looked at the treatment room. At the supply cart Tevita had already cleaned and restocked. At the neatly disposed Sharps container. At the documentation already filed. You cleaned up before I could get back there, Sandra said. Field habit, said Tevita. Sandra looked at her. The maple leaves on her compression socks were invisible beneath her scrub pants, but Tevita thought about them anyway. Small, red, repeating, the kind of pattern that assumed permanence, that assumed the person wearing them intended to be somewhere long enough for the season to change. The agency sent me your file again this morning, Sandra said finally. After Bergeron, I went back and read it properly this time. A pause. There's a commendation in there. It's buried behind 3 pages of employment administration forms, but it's there. CF Health Services, 2019. Tevita didn't move. It doesn't say what it's for, Sandra continued. Those ones usually don't. The waiting room beyond the glass partition was empty now, the 14 orange chairs vacant, the dying fern holding its own in the way dying ferns do, with quiet, stubborn persistence. The television had moved on to the afternoon news cycle, the same anchor, different disaster. I'll be in tomorrow, Tevita said. Sandra nodded. Short, definitive, the kind of nod that was trying not to be more than a nod. 7:30, Sandra said. Don't reorganize the medication room. I already reorganized the medication room, said Tevita. Something crossed Sandra's face that might, in different lighting, have been the structural precursor to a smile. Then reorganize it back, Sandra said, and walked away down the hall, her clogs making their steady, authoritative sound on the linoleum. Tevita picked up Favreau's card. She turned it over once. She put it in the pocket of her scrub top, in the flat, interior pocket meant for pens and penlight, the kind of pocket that is just big enough for one small thing you might need to reach for in a hurry. She turned off the lamp at the intake desk. She put on her coat. She walked out through the side door into the February dark, where the cold hit her face immediately, and the stars above Regent Street were sharp and unambiguous the way northern stars get, when the air is clear and the temperature drops below -20. She drove home in her 11-year-old Subaru with the heat on full and the radio off. She was not a temporary agency nurse on walk-in intake. She was still figuring out what that meant. But she came back at 7:30